Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In their opinion, of course, Bob.
All right, now that we got that out, we're going to talk today about exercising a painful hip without equipment. Now, we're also going to show you how to exercise a painful hip with equipment, but that's the next video.
Right.
So you'll have to check it out. So when you're exercising, the first rule, Brad, is do not increase your hip pain.
Right. If you're doing the exercise and it's getting worse, the more you do it, stop. On the other hand, if you do it, the first couples are irritated, but it clearly is improving after 3 or 4 repetitions.
Which is often the case.
Yeah. Then you can continue, but then see how it feels afterwards.
Right.
The next half hour, or even up to the next day.
Yeah. If it's much worse after, it's not something you want to do either.
Right.
So
you wake up the next day and you get around and say, "Oh my God, your hip hurts." Then you went too hard, too fast.
So we'll give you a couple exercises here. We got 8 of them. The first one is actually a suggestion. We'll put a link below. You should watch. We have a woman on our channel who does videos of fitness. She's an animal. You know, she can work out.
Good-looking animal.
Yeah, good-looking animal. She can. She's done some walking in place exercise videos, and they're really nice. Low impact.
Right.
So they work out great for hip pain.
Yeah, so don't worry. She's not going to work you to death.
Right.
The animal thing was, I don't know what that was.
Well, she has some videos where she...
Aggressive ones, yeah.
And the other thing is she'll film like 3 videos in a row.
Yeah.
So, I mean, she's working out for an hour and a half.
She's fit.
Yeah, she's fit. So, all right, next one, Brad. I'm going to take the mat here if you don't mind.
You bet.
I'm going to lie down. And this is one you can do when you wake up in the morning. Is you just bend your knees like this and put your ankles together, and you're going to rotate your hips back and forth. Now
knees stay together?
Yep. You know you're moving your back a little bit too, and that's fine. Get a little exercise on that too, but this is a great way in the morning to wake up and get those hips moving and get some lubricated, and it's gonna be a good start to the day.
Yep. Hip, low back, and notice his shoulders do not move.
Yeah, they are not coming over like this. They're staying steady.
Yep.
And Brad likes to call this the windshield wiper because it's like a wiper going back.
Yeah, it's like your knees. I don't know. I've used it with many patients, and they seem to remember it more easily.
Right, right. So next one, just simple marching in place. I mean, you can do it standing, or you can also do it seated. And this is a great one to do throughout the day. Just get that hip moving, especially if you're sitting for a long time.
Right. You know, if you're standing and you don't feel steady doing this, don't do it. We don't need to fall.
Right.
Or hold on to a
Hang on to
walking
something.
stick or the cupboard in front of you. I've had that with many people to help them out.
The other one is just simple sidestepping, Brad. That's going to strengthen. You know, throughout the day, most of us don't do this.
Yeah.
We don't go sideways. We go forward, and so we're strengthening only the muscles that are involved in going forward.
Right.
So that helps strengthen the muscles that are involved in hip stability.
Have a cupboard, you know, in the kitchen cupboard, or if you have a handrail or kitchen cupboard, then you have something to steady yourself. If you don't feel completely steady, make sure you're safe.
All right, I'm going to show clamshells now, Brad.
Yeah.
So you're going to lie on your side. You're going to put your ankles together, your knees together, your hips together, and you're just going to open up the clam.
Together.
Well, hips together, I suppose. So the clam is talking to you, Brad.
Yeah. So again, it's the hinge point is here, and of course your hips. It's
Yeah,
harder than it looks.
Yeah, what you're doing is you're externally rotating your hip, and these are kind of small muscles that do that. I think the glute max though does help a little bit with that, doesn't it?
Yeah, it's not just one. There's a few.
So they do fatigue after a while. You know, and with these you can do a couple sets of 10. You know, start off with, and if you get better at it, then you can maybe progress to using the equipment that we'll show in the next video.
Sure.
So, all right, next one, Brad. Hip abduction. You can do that also lying down.
Oh, yeah.
You start working on this, and it's actually you're fighting gravity, so it actually takes a little bit to. And I got long legs, Brad, so I'm working harder.
Yes, that's a lot of leverage there.
So
look at his foot. He's not pointing his toe up towards the ceiling, which is very common.
Yeah, I'm using the quad instead of using the smaller hip muscles here. So you can also do it standing.
Sure.
I'll behind a chair, or Brad's using a stick for.
Yeah. Well.
There we go.
There. yes, but not this. That's not what we want to do. 10 reps, and make sure you do both legs. I've had some patients do it like this, but I normally have them do it 10 on
It's
one
a
leg.
little more intense. It works a little bit better.
Yeah.
Brad's going to show you now wall squats.
Ooh.
And you can do these shallow if it hurts your back. But you're going to need a slippery surface, though, aren't you?
Yeah, I've had a lot of people, a nice wood door that has a nice smooth finish. Or a wall. If you got a wall that's rough, it's not going to work. I'm going to do it like this. And I'm not doing okay on this wall. I'm going to put a pillow back there. It's a little more comfortable. You don't have to worry about wrecking your shirt if you're concerned about that. And, just go down whatever you feel comfortable. You're going to bring your feet away from the wall a little bit. Make sure you have shoes on or something that offers good traction so your feet don't slip out.
Yeah.
And then you can put your hands on your thigh, or you can grab a cane or a stick or a
chair.
There's all kinds of options just to give you some steadiness if you're weak. And then you can go down further, but make sure you're never going to go down to here.
That far,
no,
right.
We're going to stay.
First off, you may never get up, but then secondly, it's really hard on the hip and knees.
This is as far as you would go. But be comfortable with it. 10 repetitions. You'll feel those quadriceps. These muscles are really working hard on that particular one. And it's working those glute maximus, the hip extensors as well.
And this final one is actually going to focus on the glute maximus there. So you can do it both lying flat, where you're going to just go ahead and bring the leg up like this to a right angle at the knee, and then you're going to lift it towards the ceiling. I always have trouble telling if I'm going straight up or not, Brad.
You're doing excellent, Bob. You'll find out a lot of people bend their knee too far or not enough. And if you bend your knee too far, sometimes those hamstrings will cramp.
Right.
And that's not a good situation.
You should try to think about squeezing your butt, too, when you're doing these. Cause
Get those butt.
Yeah, you want to actually focus on the muscle that you're trying to strengthen. And now you can do it's a little more advanced, is to do it in the quadruped position. So you're actually going like this and then going straight up. So a little bit harder.
Yep. Got to tighten up your stomach muscles and have your core really tight as well. So it's working more than just the hip, but that's all good.
It seems like even it works the butt muscles even more.
Sure.
All these you can do a couple sets of 10, or you can do one set of 10 to start off with.
Yep.
You decide. You listen to your body. One thing I always tell weightlifters, listen to your body, because if you're having a bad day, you shouldn't be pushing a lot of weights, and if you're having a good day, you might do a little more that day.
Right, and after you do them for a while, you'll know. It
you
becomes very
adapt.
familiar, and you'll know if you should do it once, every other day, or maybe you can do that every day. But that all comes into place.
Yeah. By the way, this video is
yeah.
part of a series of videos on hip pain. So if you go to bobandbrad.com, go to the program section. We got several programs there. You'll find that we have a series of videos on hip pain. You can pick out the ones you want to watch that pertain to you. Don't have to watch them all.
Right.
But you'll find something there if you have hip pain. That works for you.
And there's a PDF printout. You can print out the review of the whole video that has exercises on it, the highlights, things to remind you of what we went over. You don't have to go back and see it again. And we don't even ask your emails. Completely
It's
free.
all free. Mm-hmm. It's our gift to you.
There you go. Merry Christmas.